Hello everyone, welcome to another episode of Smartnursing, and my name is Ness Evie. So we are continuing our series on acid-base imbalances, and today we want to look at respiratory imbalances, okay, i.e. respiratory acidosis, respiratory alkalosis. Now before I proceed, if it's your first time watching us, don't forget to hit the like, the subscribe button. Tell somebody about this channel, okay? Let's grow together. Now if you're a returning subscriber, thank you for watching, and you are always welcome. So let's dive right into it. What are the respiratory acid imbalances? So we talked about acid-base imbalances in general, and we said that the pH usually determines what it is, okay? So your pH will tell you whether it's an acidosis or it's an alkalosis. Now the type of acidosis or alkalosis it is will also be determined by your carbon dioxide or your bicarb. And we said that carbon dioxide usually is from the respiratory side, and then bicarb is usually from the metabolic side. Okay, so today let's look at respiratory acidosis. Okay, so what happens in respiratory acidosis is basically there's going to be reduced pH, which means that the pH will be less than 3.5, because remember we said the normal pH is from 3.5 to 4.5. Okay, so in respiratory acidosis, you're going to realize that pH will be reduced and carbon dioxide will be up. Okay, so there is this acronym we use: respiratory opposite, metabolic equal. What it means is that when you have a respiratory problem, you're going to see that the carbon dioxide and the pH are going to be going in opposite directions. If pH is low, carbon dioxide will be up. So respiratory opposite, metabolic equal, that is what ROME stands for. So what is the pathophysiology behind respiratory acidosis? It usually stems from hypoventilation. That is the basic, that is the whole explanation of respiratory acidosis. Hypoventilation. The patient is not able to breathe normally. The patient is not able to push out that carbon dioxide. You know, as we breathe out, you breathe out carbon dioxide and you take in oxygen. So if you're not able to breathe normally, you will retain that carbon dioxide in your system. And from the previous video, we understand that carbon dioxide is basically acid in this context. Okay, because when you look at the equation, you're going to see that carbon dioxide will combine with oxygen, then it will dissociate into hydrogen ions and the carbonic acid. You get it? So the hydrogen ions that are being, dissociated, expelled, that is what is causing the acidosis. So basically, we don't want too much carbon dioxide in the system. So in hypoventilation, carbon dioxide is retained. Now there are going to be some cascade of events, and at the end of the day, you're going to have acidosis, and which is going to shift the pH to be less than 3.5. Okay, now what are some of the conditions that can give you hypoventilation? An example is an opioid overdose. Opioid overdose because there's going to be CNS depression, there's going to be respiratory center depression, there's going to be breathing depression. So the patient cannot breathe as he or she is supposed to, or on normal circumstances. That is going to retain carbon dioxide. Maybe it's a neuromuscular disorder, maybe myasthenia gravis, Guillain-Barré, okay, some neuromuscular problem of a sort. Respiration needs muscles. So if you are not able to use your muscles very well, then you're not going to push out that carbon dioxide. Then it will be retained in your system. That will lead to respiratory acidosis. Okay, another example is COPD. Okay, you are not able to breathe well. So anything that you can think of that suppresses your respiration, that will give you hypoventilation. then you're going to have acidosis out of that. Okay, and if that happens, you will see that the kidneys or the metabolic side will try to increase your bicarb. Remember, anytime you see bicarb, think base. Anytime you see carbon dioxide, think acid. Okay, so during respiratory acidosis, the kidneys or the metabolism will try to increase bicarb in your system in order to buffer that situation. Okay, don't worry, we will look at compensatory mechanisms, and then we'll also look at how to identify or interpret ABG to tell whether this is a respiratory issue, and then whether it's being compensated, and even if it's compensated, is it fully compensated or partially compensated. Okay, so that is that for respiratory acidosis. So how about respiratory alkalosis? For respiratory alkalosis, what happens is that pH will be up and then carbon dioxide will be down. It's just the direct opposite of respiratory acidosis. And what is happening in alkalosis is hyperventilation. So hypoventilation in acidosis and hyperventilation in alkalosis. So in alkalosis, the bottom line is hyperventilation. So you are blowing off too much carbon dioxide. Now, know that even though it is acidic for the body, it is not supposed to go beyond the lower limit, which is 35. It is not supposed to go beyond that one. So you hyperventilate, you're breathing so fast, you're blowing off carbon dioxide, you can go into respiratory alkalosis. Okay, an example is anxiety disorders. Okay, anxiety or panic attacks when the patient is having the very fast breathing. Okay, breathing so fast. That way, you're blowing it off, you're blowing it off, you're blowing it off. Then there's going to be lesser value than it is required in the system. That will give you what we call respiratory alkalosis. It's sepsis or pulmonary embolism. Okay, sepsis or pulmonary embolism. How does sepsis and pulmonary embolism give you respiratory alkalosis? The answer is simple. There's increased respiratory drive. There's increased respiratory drive. You're in a respiratory failure like a hypoxemia. Okay, so you're hungry for air. There's that drive, there is that edge. Okay, so your body responds by breathing so fast to get that oxygen that you need. The increased respiratory drive is going to cause hyperventilation that will blow off excess carbon dioxide. Okay, another example is how altitude. Maybe the patient came in with probably a history of going mountain climbing somewhere. Okay, and then all of a sudden they cannot breathe well and they come and they're hyperventilation. Think respiratory alkalosis. Okay, because high altitude, there is reduced oxygen, so that reduced oxygen is going to give you the hypoxemia that will also increase your drive. Okay, so when this happens, like I said, the metabolic side will also try to compensate. So when we are having respiratory alkalosis, you will see that bicarb will probably be reduced. Okay, you want to reduce the base component to see if maybe some acidic components can come up. Alright, so basically that is what respiratory acidosis and respiratory alkalosis mean. It's basically hypoventilation as against hyperventilation. Thank you very much for watching, and we will see you in the next video.